Chiropractic, and we have Doris with us, and this is day 4, I believe, right?
Yes.
And we had a little bit of a gap between our treatments, but we're picking up. And is there anything you want to share, what we were just briefly talking about before I hit the live button here, what you noticed?
Yeah, I'm starting to notice more tingling. The other days it was more centered here in this area. But I'm starting to get more tingling in my forehead, in my cheekbone. I feel like I can press this side of my lips a little bit more.
Like you're able to use it a little bit more?
Mm-hmm.
Okay.
Yes, or like compress it more.
Okay.
Make it tight. But that's about it. So I'm looking forward to more sessions to see more results.
Awesome. Guys, with Bell's palsy, not always quick and easy to help this regenerate. So you have the cranial nerves that are exiting out, and we're going to be targeting cranial nerve number 5 and number 7 on her, specifically in the atlas. We tend to work with that area the most because the atlas bone can misalign in 21 different directions. That'll put compression on the cord as well as the cranial nerves that exit out through the patterns of the head. And so what she's starting to get is what's called paresthesia, and she's starting to get that feeling back as those pinched nerves are on, sort of like unkinking a hose and allowing that flow of energy to move through. And so she's starting to feel, and they're starting to become more function. So we're going to be targeting cranial nerve number 5 and 7. More specifically, you'll notice I'll do some hand work today with her, also some other work with the instrument that'll be more targeted in the upper atlas bone, as well as using some low-level cold laser that helps regenerate, and that increases a lot of the energy in the cell called the mitochondria, and that's the ATP, that's energy in the cell. Essentially, as we get younger in life, things start to become what we call deoxygenated, a little less oxygen in the body, and so we're going to help ignite that a little bit for her. So let's have you go face down for me, Doris. We're going to start out with the chiropractic adjustment. Usually I start patients out to relax them with a little bit of traction. This helps stretch the spine out. I do full spine, full body adjusting on people. And we're going to be utilizing the heating pad. This is a moist heating pad. I prefer, if people are going to use any kind of heat, moist heat is the best to be using because that helps, one, to bring some moisture, but it brings some flexibility to the tissues, increases blood flow to the area as well. So I use the traction, this is called a distraction, lumbar flexion distraction table, and it helps hydrate the disc, stretching the tissues, but I have it on a lower setting for her. I'm also going to do some traction at base of the skull or back of the head, as well as the sacrum area. This helps increase the spinal flow, which is called CSF, the spinal fluid that's in the spinal cord. So patients will start to feel more movement in through the lower back as well as the head when we do this. This is only her 4th treatment. It's not uncommon when patients present, if it's non-traumatic Bell's palsy, this one was insidious onset, or we don't even have an origin. She just woke up and it was the paralysis on the side of the face. So, you know, it's not uncommon to see a series of treatments that progressively change over time. This is not your typical low back, neck pain people come in for. This is something a little more serious, and that's when you see patients coming in that have various conditions, how important it is to address that and build up a little bit at a time. It's no different than when you go to work out. Maybe you start your first 30 days, and those first 30 days in the gym are challenging to the body because you're making a lot of change in there. So thank you for watching, guys. How you doing? You okay?
Yeah.
Deep breath all the way in and relax it all the way out. I like to use a massager to bring more blood flow to the tissues, help relax the area. So we're going to work around the side joints and the hip area. You're not itching from this, are you?
No.
You okay? She holds a lot of tension across the shoulder blades, base of the neck, Go ahead, we're going to test the sacrum. So what I want you, no, don't move. Go ahead, raise your entire right leg without bending the knee for me. Back down, try the other one. Back down. So good motion in there. That's primarily checking the sacral plexus or the sacrum bone right here. People have a lot of SI pain typically with that test. Look pretty good in that area, so we're not going to even touch that today. She's slightly short on the right side. She's about a 1/2 inch short. We're going to bend it into the second and third position. Leg goes shorter. So we have L4, lumbar vertebrae right here. I want you to lay on this side, face me this way. Bend this knee right here. Good. And let your body come toward me. Good. Good. On your back. Doing okay?
Yeah.
So we had a movement at L4 that tends to talk to the lower leg muscles outside of the leg. Take a breath in, release. Roll out for a minute, I'll be right back in. Okay, and now we're going to be using an instrument called the part release instrument. It's an integrator. This helps change the function of the atlas bone. Lift your head for me, back down. Good. Turn your head to the left for me. We have an instrument that I use typically in the upper cervical area. It's a controlled force. It can do up to what we call 7 newtons of force to actually take some of that pressure off the bone. The uniqueness of this instrument is that it has a torquing motion or a twisting motion to unwind the tension so the vertebrae can misalign in different directions, and it adds a torquing motion, kind of like some of the tools or instruments that are used. And it's a lot quicker than my hand can generate in speed. You'll hear a click. Good. Take a breath in. Release out. Good job. Okay, next we're going to do a traction. You liked this one last time, didn't you?
Oh, we hold it?
Yeah. Lift your head, back down. So the reason I'm using a pillowcase or a towel here is so I can get a better grip. Good. Good job.
Wow.
Does that feel better?
Yeah.
Okay. All right, we're going to start the program here. I want you to go ahead and put the glasses on. These are safety glasses in case the laser does come across the eye. All right, we're going to do a few minutes here. 3, enter. I'm going to put that on pause again. All right, we're going to be working on cranial nerve number 5 and 7. So you see that I have it in the pattern of the lower jaw right here. She has the glasses on. And this increases the energy into the cells. Particular cells are the mitochondria, increases ATP, increases oxygen flow. I already preset the frequencies that go into the co-laser. I've used this for wound therapy, acne, carpal tunnel, fibromyalgia, you name it. There's various conditions that are definitely helpful. Tinnitus, vertigo. In this situation, we're using Bell's palsy. There's two diodes or two lights that are coming through. One's infrared, the other one's ultraviolet. And this particular instrument has a deeper penetration, so I'm doing a shorter time on her. Right now I'm starting out with 3 minutes. I may go back over and reduce some of that area. How are you doing over there? You okay?
I'm okay.
Okay. And we're going to go just a bit closer there. Okay. And take a deep breath all the way in and release it. Good. Now the breath helps to release a lot of the tension. You know, a lot of people have stress, different levels here. And you drove quite a way to get here. She drove from Federal Way, so she passed probably about 100 chiropractors to get here, didn't you?
Yeah.
Yeah, so she had to go around quite a bit of way down. It's just south of Seattle, and just north of the Tacoma area. I'm going to say like in between, and then over to Lacey here. And she's tried various therapies. She's still doing acupuncture, and I encourage her to do that because that's another great way to help with some of this. But would you say that you've started getting more results because you started doing the chiropractic with the acupuncture, or about the same?
It's about the same for now.
But overall, there's been an improvement?
But overall, yes, more tingling since I started the chiropractic.
And you were seeing a chiropractor before, though, weren't you?
No.
No? When was the last time you went to a chiropractor?
Maybe about 2 years ago.
Quite a while ago.
Mm-hmm.
And what made you decide to want to go to a chiropractor now?
I just been looking around, trying to find a solution for this problem, and I found you on YouTube.
YouTube?
Yes.
Pretty amazing. Okay, now we're going to go right by the atlas bone. We're going to bring it in nice and close on you. You okay?
Yes.
And next we'll do the pattern, cranial nerve number 7, or we're going to do the pattern right through this area. Excuse me. Right above the head, this will be the temporal area and the parietal area right through here. So you have a lot of the branching of the cranial nerves that go through this area. Top of the face, top of the cheek, bottom of the jaw right through here. Right now though, I'm on the atlas bone. This particular bone can move or misalign in 21 different directions. In fact, most chiropractors consider this one of the more important areas that we work with because it affects the entire nervous system right from this point. There are some practitioners that specialize in just adjusting that area alone. Doing okay?
Yes.
So we have a few minutes on that area, and then we're going to move over to cranial nerve number 7 right there. I hope you guys are finding this interesting because it's amazing to watch this kind of healing happen for people. So right now we're along the muscle and dermatome patterns, so the myotome muscle patterns and dermatome skin patterns for the upper neck, and we call that the upper cervical area. You're doing really well. Good job. And I really appreciate your positive, your good feedback, and since we've been working together. On our last couple of videos, her daughter Emma was here, and we've been kind of, that brought a smile to your face. We had to jockey around and did the best we can. You know, it's tough when you're a parent, you know, the little ones, you know, they get into everything. I know I have one. Now she's going to be 15, so. Good, we got about 40 seconds left, and then we'll transition over. If you guys have any questions, feel free to ask. Maybe I'll see it on the screen from way back here. If not, I'll try to answer them later on for you guys. Thanks for watching. Okay, now we're going to move over to cranial nerve number 7. And you can move your head back to the center for me. We're going to change the angle of the diodes right here. You good? It's not hitting you in the eye, is it? You good?
My eyes closed.
Okay, good, good. Right there. You're good?
I'm good.
All right. So right now, as the laser is going into those areas, I'm going to do some soft tissue work. People get migraines, headaches, dizziness, vertigo. I like to do the work right. Do you feel that right up through here? You okay?
Yeah.
Okay. Right between the atlas bone or C1 and then the occiput. I get in between those two areas to release some of the pressure and tension that goes on through there. And just a light traction with the fingers that helps release some of that area. So I want you to focus on your breath through the nose, out through the mouth for me. Just a light traction through there. We're going to turn that just a little bit more. Good. I hope you guys found this interesting as we go through some of this work. And I'm doing this series with this. Doris was fine with me presenting this to you, especially if it could help other people on there. If you look at an older video, go on YouTube, you'll see one of my other patients from a while back, but I haven't done one in a while, on Bell's palsy. A particular gentleman in Tacoma, so you'll look up Accident Injury Chiropractic, and you'll type in my name, and you'll look up Bell's palsy. You'll see some great feedback from that individual. I think I saw him, I don't know, 7, 8, 9 times, and we had some really great changes, so he was pretty ecstatic about that. I haven't thought of that in a while. Good. Okay. And after this is done, we're going to work on our posture in a sitting position, and then we'll call it for today. Probably the easiest part of my job is sitting around and waiting for the laser right now. So it's actually moving at 4 frequencies that are pre-programmed into it, and for Bell's palsy in particular. So we're going to be increasing the duration. Okay. Good. And let's have your glasses off for me. And I'm going to have you go to a sitting position, sit and face that way for me. Good. So we're going to work on the posture again. This is one of our goals that we're working on continuously. Nice arch into the lower back. Bring the shoulders back. And this is the big one. This is where a lot of the neck and head problems come from. Can you retract that back for me? So you got to work on that a little bit more. You've been working on it?
I've been working on it.
Okay, keep at it. So you have to translate the head back. So I want you to take a breath through your nose, out through your mouth. Good. This is called arthrostim. It's a light force adjustment. Good. Breath in the nose, out through the mouth. Good. We're going to adjust shoulders, so bend your elbow here. Drop your head down. Good. Other one. Good. Back to that position again. Translate that chin back for me. Good. You're going to work on that where you're going to contract those muscles. Relax. 2 things you're going to do next. This is a key thing to helping get that tension off the atlas. You're going to take a towel, sort of like the one, a pillowcase or a hand towel, put it behind your head, sitting up straight, and press your head against the back of that towel. Hold it 10-15 seconds. Relax. Then you're going to put the towel in the back of the neck here. You're going to do the same thing. Add pressure, but you're going to do it with the neck. Let me get a towel and I'll show it to you. So guys, this is something you can do at home. I've done videos on this as well. So the head will just simply sit like this, and you'll retract the chin back. I'm contracting it, back of the neck. Then I'm going to do this where I put it back of the neck and push my neck against the towel. When you first start out, go really slow. Go careful, just because the muscles aren't used to engaging. That's going to help bring that posture back again, okay? Any questions? Good job. All right, guys, I'm Dr. David Warwick at Warwick Chiropractic in Lacey, Olympia, Washington.